Epistaxis nosebleed. 1. Introduction. Nosebleeds are very common. Most nosebleeds occur because of minor irritations or colds. The nose contains many small blood vessels that bleed easily. Air moving through the nose can dry and irritate the membranes lining the inside of the nose. Crusts can form that bleed when irritated. Nosebleeds occur more often in the winter, when cold viruses are common and indoor air tends to be drier. 2. Definition. A nosebleed is loss of blood from the tissue lining the nose. Bleeding most often occurs in one nostril only. 3 types. Anterior nose bleeding. Posterior nose bleeding. The vast majority of nosebleeds occur in the anterior, front, part of the nose from the nasal septum. This area is richly endowed with blood vessels, causas plexus. This region is also known as Little's area. Bleeding farther back in the nose is known as a posterior bleed and is usually due to bleeding from Woodruff's plexus, a venous plexus situated in the posterior part of inferior meatus. Posterior bleeds are often prolonged and difficult to control. They can be associated with bleeding from both nostrils and with a greater flow of blood into the mouth. Sometimes blood flowing from other sources of bleeding passes through the nasal cavity and exits the nostrils. It is thus blood coming from the nose but is not a true nosebleed, that is, not truly originating from the nasal cavity. Such bleeding is called pseudoepistaxis, pseudo plus epistaxis. Examples include blood coughed up through the airway and ending up in the nasal cavity, then dripping out. 4 causes. Nosebleed can be caused by irritation due to allergies, colds, sneezing or sinus problems, very cold or dry air, blowing the nose very hard, or picking the nose, injury to nose, including a broken nose, or an object stuck in the nose, sinus or pituitary surgery, transsphenoidal, deviated septum, chemical irritants including medicines or drugs that are sprayed or snorted, overuse of decongestant nasal sprays, oxygen treatment through nasal cannulas. Repeated nosebleeds may be a symptom of another disease such as high blood pressure, a bleeding disorder, or a tumor of the nose or sinuses. Blood thinners, such as warfarin, coumadin, clopidogrel, Plavix, or aspirin, may cause or worsen nosebleeds. 5 diagnostic tests. History taking. Physical examination. Complete blood count. Nasal endoscopy, examination of the nose using a camera. Partial thromboplastin time measurements. Prothrombin time, PT. CT scan of the nose and sinuses. 6 treatment. Home care. Sit down and gently squeeze the soft portion of the nose between your thumb and finger, so that the nostrils are closed, for a full 10 minutes. Lean forward to avoid swallowing the blood and breathe through mouth. Wait at least 10 minutes before checking if the bleeding has stopped. Be sure to allow enough time for the bleeding to stop. It may help to apply cold compresses or ice across the bridge of the nose. Do not pack the inside of the nose with gauze. Lying down with a nosebleed is not recommended. You should avoid sniffing or blowing nose for several hours after a nosebleed. If bleeding persists, a nasal spray decongestant, Afrin, neosynephrine, can sometimes be used to close off small vessels and control bleeding. Get emergency care if bleeding does not stop after 20 minutes. Nose bleeding occurs after a head injury. This may suggest a skull fracture, and X-rays should be taken. If nose is broken, for example, it looks crooked after a hit to the nose or other injury. If taking medicines to prevent blood from clotting, blood thinners. Past history of nose bleeding. If nosebleeds are not associated with a cold or other minor irritation. If nosebleeds occur after sinus or other surgery. Hospital-based treatment. Treatments depend on the cause and could include nasal packing, gauze, special nasal sponges or foam or an inflatable latex balloon is inserted into nose to create pressure at the site of the bleed. The material is often left in place for 24 to 48 hours before being removed by a healthcare professional. Cauterization. This procedure involves applying a chemical substance, silver nitrate, or heat energy, electrocautery, to seal the bleeding blood vessel. A local anesthetic is sprayed in the nostril first to numb the inside of nose. Medication adjustments. New prescriptions. Reducing or stopping the amount of blood-thinning medications can be helpful. In addition, medications for controlling blood pressure may be necessary. Tranexamic, Listida, a medication to help blood clot, may be prescribed. Foreign body removal if this is the cause of the nosebleed. Surgical repair of a broken nose or correction of a deviated septum if this is the cause of the nosebleed. Ligation. In this procedure, the culprit blood vessel is tied off to stop the bleeding. 7. Prevention. Use a saline nasal spray or saline nose drops 2 to 3 times a day in each nostril to keep your nasal passages moist. Add a humidifier to the furnace or run a humidifier in bedroom at night to add moisture to the air. Spread water-soluble nasal gels or ointments in nostrils with a cotton swab. Bacitracin registered trademark symbol, Vaseline registered trademark symbol, or air gel registered trademark symbol. Be sure not to insert the swab more than a quarter inch into nose. Avoid blowing nose too forcefully. Sneeze through an open mouth. Always sneeze into tissue or into the bend of arm. Avoid putting anything solid into nose, including fingers. Limit the use of medications that can increase bleeding, such as aspirin and ibuprofen. Quit smoking. Smoking dries out your nose and irritates it. Wear protective headgear if involved in activities that could result in an injury to face and nose. Keep fingernails short.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.